Hello, my name is Mantasha. I'm a second-year nursing student at Camosun College. Today I'll be demonstrating intramuscular injection for my patient Pat Rees. Prior to doing this administration, I will start off, before entering the room, I will go into my medication on my med cart. From here, I will review patient chart. I will confirm my patient name, date of birth. From here, I will first look into the patient prescriber's orders. From here, I do see the prescriber order is morphine 6 milligram intramuscular Q4H-PRN. And so morphine is an opioid analgesics, primarily used to treat pain. It does match with my patient history based on the fact that she did come in. Pat did recently get discharged from a surgery, and so this does match with the need to address her pain needs. Pat had also prior to this had mentioned she had recently had pain concerns, and so I will be applying this PRN medication to help alleviate the pain. I will compare the prescriber's order with the medication administration record and do see that morphine 6 milligram intramuscular Q4H-PRN. From here, I have done my dosing calculation. Before I begin, I am going to prepare the sepsis by performing hand hygiene. I did get my, I will compare. I did ask the nurse in charge, MRN, to get morphine. Morphine is a controlled substance, and so as a narcotic, it is something that I will have to ask my nurse to retrieve for me. With morphine, the vial that was given to me is 10 milligram per ml, and so with my calculation, my patient requires 6 milligram, which means that with my calculation, I am to retrieve 0.6 ml for the right dosage. And for my equipment today, I will be using a 1 ml syringe. To retrieve the morphine from the vial, I have a blunt fill needle, and then I will also to apply the intramuscular, I have used a 23 gauge 1-inch needle because it will be applied to the deltoid muscles. So I will now perform the first check. This again will compare with the right patient, the right medication, the right route, time, and the dose, the date. And I will also check to confirm the expiry. I do see that the medication is not expired. It is the right medication for the right patient. Morphine 10 milligram per ml, Pat Rees. And again, I will compare this with my order. This is intramuscular. And so I've completed my first check. With that, I'm going to open up the vial. I'm going to clean the vial for 15 seconds. After the 15 seconds, I will wait for this vial to dry up. Naturally, I will not try to blow into it as I will try to control the sepsis. I will now again perform my second check. Again, the right patient, right medication, right route, right dose, and right time. I'm now going to prepare my syringe with my
Perfect. And then I'm just going to be doing my third check before releasing. So I put that there. Before releasing our dish. Alright, so I see here it is hydromorphone for pat release. It is 0.5 milligrams, which I need, so I'll take out 0.25 milliliters. So I'm going to get that 0.5 milligrams.
Okay. Now, prior to retrieving this, I am going to have the air out at 0.6. But prior to retrieving this, I'm going to now have enough air out, which is at 0.6 ml as per my calculation. That is the amount of air that I will apply in.
The work area is small. I put that other bedside table there to use too if you want. It's too crowded.
Okay.
And then I'm going to put on my red stopper. Which is going to be second technique. Like so, and then I'll put that from there. Go all into the garbage. And then I'll be getting into the patient's room. And making sure to keep on my medication label so that in case any discrepancies happen, I'll always know what is on the medication. And then as you see here, it is the calories.
So I am going to put the needle through. I do have a little air bubble, so I'm going to try to tap the air bubble out. And I have it out on the top. And because this is a controlled substance, I am going to dispose this in a waste disposal, in the shop's container disposal.
So put it from the glass.
I'm just going to
And I'm just getting rid of the air bubble. Yes.
And then we also represented to the hi, my name is Krista. I am a Camosun college student nurse. Today I'm going to be administering you your pain medication. Is it okay to do at this time? Perfect. Can I just have a look at your wristband? I'm just going to put your bed height a little bit up so that I can look at my wrist height. Alright, can you please tell me your first and last name?
That didn't go that well.
Okay. Just carry on. Tell us what you do in real life.
So in real life, I've had a bubble that is a little bit harder to do. So what I would have done would be to actually put this, dispose of it, and then draw new air, and then try to draw out from a new file, and to ensure that my bubbles are gone out. After doing so, I would ensure that I have drawn exactly 0.6 ml as part of my calculation. And once done so, I will now perform my third and final complete check. And again, this is to ensure I have the right patient, right medication, right drug, right route, and right time. With that, I would then also put my label through.
Hygiene before putting on my gloves. Even though I'm not contacting any bodily fluid, it's still advisable to put on gloves when administering medication.
And again, I'm going to ensure that it is visible, that it's drawn out at 0.6 ml with the vial out and my patient label. And because it is a controlled substance, I'm now going to have a second check with my nurse MRN to ensure that this is the right dose. And so I'm going to have my nurse independently check this with the patient order. And once confirmed, I will now then proceed ahead with my
So you need to
patient.
put that out so that Carla can do that independent double check for you. And I'll zoom in.
And then I'm going to be attaching the medication now. Alright, making sure that the space is tightening. And pushing it in and twisting. And then I'm going to be pushing it in slowly.
All right.
Alright, Cal, I'm just going to be tapping on your skin here. Don't worry, it's nothing
With that said, I am now going to prepare the right needle, in this case here. And so I will perform another hand hygiene to ensure that sepsis, sterility, and the sepsis is maintained.
Turning this into my sharp container as well. Alright, Kat, how do you feel? Feeling alright? Alright, so I'm just gonna let you know also, with this medication, you may feel a little bit of, you may have some constipation, you may feel a little bit dizzy, you may have some stomach problems, they're all fine. You may be nauseous or feeling to vomit. Those are just some side effects of the medication. However, if you do feel anything out of the ordinary or you do feel some excessive pain, please just put your call
And so I have my medication ready, and as prior to getting into the room, I will also ensure that I have my gloves in, as there is a chance of bodily contact fluid, and so for that I will need my gloves.
vital sign check, just looking at your rest, your lung pressure, your SpO2 again. Also doing another key assessment, and then just looking at your GI, just like kind of seeing how everything's working. But everything should be fine. The hygiene also should look out for you. If there was any problems that you have or any concerns, you can let me know now. If
And so
not,
with this, I'm going to go into the patient room. Before entering the room, I have read through the patient chart and I have done my point of care risk assessment. Prior to going into the room, I am doing my general survey. And I see my surroundings and ensure that all my surroundings are clear. The bed breaks are on in. Good morning, Pat. My name is Mantasha. I'm a second-year student nurse. I'll be your nurse this morning to apply for your morphine. Do you have any questions today? Okay, excellent. Privacy, I am going to ensure that the curtains are on. Now, before I begin, Pat, can I get you to confirm your name and date of birth?
And Pat did?
Excellent. Any known allergies?
No known allergies.
Excellent. And I have also looked through my patient records to ensure that it did match, especially with the patient allergies as well. For maintaining stable, I will have the bed raised. Now, Pat, I'm going to be applying morphines into intermuscular as an injection. Now for this, it is going to help with your pain that you've mentioned to me. Do you have any questions about this medication?
Nope, all good. Thanks. I've had it before.
Excellent. Now, this medication will be applied onto the deltoid muscle. I will first do a landmark for the site. And to find the site, I have identified the chromium process, which is this bony region up here. To identify my landmark, I'm going to use the 4-finger technique, using one of my fingers covering the chromium process, and the landmark region will be underneath the 4th finger, which is just 3 fingers below the chromium process. It will be a triangle shape in an upside down one. And so this would be a region that I would use for my landmark.
Perfect.
And with that said, I have prior to, I'm going to do my gloves. So with that, I'm going to take an alcohol swab, and I'm going to swab for 15 seconds on the site and allow it for it to dry. Now, once the site is clear, I'm going to use this as a demonstration. I will use the Z method technique. And so once the site is dried, I'm going to use my non-dominant hand, which would be my left hand, to put the sides through. And then I'm going to then clench the area. And then I'm going to use my dominant hand to have the injection ready. And with that, I'm going to ensure that the needle is clear. So with that, using the Z method technique, once I grasp a little area, I'm going to go 90 degrees in a dart-like motion. After doing so, I'm going to slowly inject. Once I have injected all, I am going to wait 10 seconds before removing the injection site. I'm going to ensure that the caps are closed and dispose of it. And at the same time, I'm going to apply gauze and apply pressure into it so that there is no bleeding. And once I do confirm that there is no bleeding, I am going to then remove the gauze. And with that, Pat, your injection is complete. I am going to come back in after 15 minutes. You should feel the effect in 15 minutes. I'm going to come back in 15 minutes to see how you're doing and reassess your pain. Prior to doing the injection, I would also have done a pre-assessment where I would have asked Pat about her current pain condition as well. So thank you again for your time, Pat. Once I leave the room, I'm going to go back into the panel. Here I would document under my medication administration, my medication that was applied, and time and initial. I would also have the documentation of the narcotics placed in here. And once done so, I will check in on my patient. And thank you.